Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. For the month of March, we're focusing on the intersection of public health and public libraries. Libraries can play an important role in the health of their communities, providing programming and resources to patrons, but they also serve as a place for gathering. Jenny Bossaller, a professor of library sciences at the University of Missouri, recently sat down with Robin Westphal, the executive director of Daniel Boone Regional Library in Columbia, to talk about the important role libraries can play as a tool for connection. Here's Robin.
One thing about a public library is that we've always been really good at adapting it to make sure that we remain relevant. I think when you go into this profession, you're going to have to make sure that you are relevant and continuing to evolve with what the needs of the community is. We see as, in some cases, some funding cuts to public health or people not having access as easily as they did before, that the public library has to step in and fill those roles.
Yeah, one of my classes is on community partnerships. And so we talk about partnering with doctors, aging groups like AARP, certainly with preschools and colleges, schools. There are all kinds of ways that libraries can partner, and a big component of that is one of the 8 dimensions of health, because there are so many different ways that librarians can contribute to health, whether it's through financial health or actual healthy bodies, mental health. Simply not being lonely is a big way that libraries can contribute to their community's health, because they have programs that are open to everybody and people of all ages.
And Jeannie, that makes me think of how important our outreach services are that we provide. Those home visits to folks who otherwise would not be able to come into the library. And what we recognize is that it is so much more than the fact that we're bringing them 10 or 12 books that they can read. It is, we recognize this, that in some cases we're the only personal contact that they're having with another human being when we come and do those deliveries. And so we make it a priority that while we can't stay all day, we want to do more than just drop the books off. It is checking on and seeing how people truly are doing. And in some cases, that means making sure if we recognize that there's probably maybe some health concerns that need to be addressed, that we are helping them. Maybe you need to call your doctor. Is your son or daughter somewhere close that we can, help make that connection? Boy, that is just an additional layer of what it is that librarians are doing, to truly checking in on people in their homes.
That was the executive director of Daniel Boone Regional Library, Robin Westphal, and Jenny Bossaller with the University of Missouri, talking about how public libraries can combat isolation and connect communities. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.